I recently had a question from a viewer that said, I've been taking metformin for 2 weeks. I'm not losing weight. What's wrong? Well, I'm not sure that anything's wrong. I think there's a lot more information that we need to talk about regarding metformin and weight loss. So this will be metformin and weight loss part 2. We'll talk a little bit about dosage, how to get started, expectations in terms of timing. Then we'll talk about, again, a little bit more about the science behind it. How does it work? So for example, do I take 250 or 300 of metformin once a day for 2 weeks and then the weight loss falls off? So we'll talk about those in just a second. Again, this is Ford Brewer with Prevmed, heart attack, stroke, disability prevention. And I used to not do a lot of weight loss, but I'm responding to the demand and also finding that weight loss is a critical part of heart attack, stroke, and disability prevention. So first of all, I took metformin for 2 weeks and I don't have any weight loss. Well, I understand that. Most people don't have any weight loss after 2 weeks. In fact, most people don't get a decrease in appetite after 2 weeks of metformin. We'll talk about that in a few minutes, but the bottom line is that this takes more like a month. And I think that has some implications regarding the mechanism on how metformin works. We'll talk about that as well. So, a couple of comments about dosage. In the U.S., you tend to get metformin available in 500 or 1,000 milligrams. Outside of the U.S., you can get them in 300 or 400 and 800 and 1,700 milligrams. So, what I would recommend is that you start with the lower doses. Even in the U.S., especially with people that do have some history of GI distress, I recommend that they start with the 500s and cut them in half. Take the 250 dose for a week, once a day, then titrate up. Add another 250 or make it 500 for the second week. If you're not having any GI problems, you can go ahead and increase faster. Again, the GI problems, flatulence, gas, diarrhea, those are the most common side effects that you see. And they probably have to do with the major mechanism on how metformin works in the body. It changes the gut biome. We'll talk about that in a few minutes. Let's talk about another critical piece to this, though. And while we talk about that, we'll get into the science and mix a little bit of the science with the how-to piece. So this is this was a critical study where basically they took kids that were not diabetic. They were 13 to 18 years old. They followed them for a couple of years, and they gave them metformin. Now, they did lose weight. They lost, on average, about 10% of their body weight. Now, that's another fact behind this. I wouldn't expect to lose half my body weight, again, just taking metformin alone. What I think metformin mostly does is decrease your desire for food, and again, we'll talk about mechanisms in a few minutes. But here's a couple of other key points on this study, which are key points for anyone thinking about losing weight with metformin. Again, number one, it was 48 weeks. It was a year. Number two, there was a major lifestyle component. So, again, it's not just taking a pill and then expecting everything to happen. You have to do other lifestyle components like exercise. I also recommend other dietary components. I actually recommend 3 additional dietary components. One is a low-carb diet. Number 2, intermittent fasting. And number 3, mimicked fasting. The low-carb diet has an impact on several things, including glucose fluctuation, especially for those of us that have insulin-resistant components. The intermittent fasting and the mimicked fasting both have a major impact on the addictive relationship we tend to get with food after eating 3 and 4 times a day or more for decades. Pardon me just a minute. Okay, so here's some other studies regarding impact of metformin. This was, again, very, very well documented in terms of weight loss and glucose control in diabetics, in people with insulin resistance, and as you saw with the first article, even with folks without insulin resistance. So it's a major promise for the pediatric obesity epidemic that's hitting the U.S. right now. This actually is the article on pediatric obesity in kids that are young. I think these were like 6 to 12-year-old kids that were already developing some insulin resistance associated with obesity. Again, just another article looking at metformin, weight loss, appetite, and this was in folks with diabetes. As you see, these are coming from some academic articles. Now let's talk for a minute about mechanism. Most doctors know and think about the mechanism where metformin decreases glucose production by the liver. There's not a lot of recognition or understanding that metformin actually changes the gut biome. And but I will say there's a lot of recent lay press with discussion about and buzz about the impact of the gut biome on the brain in terms of mental health, depression, and I would add clearly appetite and weight maintenance. Here's another one. This is the, by the way, that article, the book I was just showing you is Brain Maker. David Perlmutter, who's both a neurologist and a nutritionist, has written a couple of books, Grain Brain and Brain Maker, both about the negative impact of grains and complex carbohydrates on the gut and its resulting impact on the brain. Now, looking at other lay press headlines, as you see, your gut bacteria may be controlling your appetite. So, we're starting to develop a question here around maybe the impact of metformin on weight loss actually has to do with gut. And actually there's significant research in this area. This comes from the ADA, American Diabetes Association, and their online articles. According to this researcher, they think the primary glucose lowering effect of metformin resides in the gut, not in the circulation. So again, what this group did was they looked at the extended release metformin versus immediate release metformin. Their point was extended release has much more of an impact in the gut and less of an impact in the liver and bloodstream. They saw improved glucose metabolism as a result of that. Here's an interesting article. Nature Medicine just came out over the past couple of months. Now here's what they did. They took a study population. At different times in the timeline, they started different study subjects on metformin. They tracked their glucose metabolism. They found a change in glucose metabolism based on when they started taking metformin. Then they did an interesting part. They did a fecal transplant to mice. And yes, there's an ick factor there. But what they did was, after patients or study subjects developed an improvement in their glucose metabolism, they took a fecal sample from the subject and inserted it or transplanted it to mice. What happened to the mice then was very interesting. The mice demonstrated the same impact on glucose metabolism, improved glucose metabolism from a change in their gut biome. Now there are several, so why are we talking about gut biome again? Metformin impacts the gut biome. There's a lot of research around that area, a lot of it over the past few months. There's 2 or 3 significant trends that you see with metformin. Number 1, it decreases Bacteroides species. Number 2, it increases E. coli species. And number 3, it increases these species here, the Akkermansia species. Now, what's the impact of all of that? Well, we know that the impact of all of that is improved glucose metabolism. There's also significant evidence, and this is what I think, it also improves appetite or decreases appetite. So, again, this is maybe beyond cutting edge, maybe bleeding edge science, but I think that there's a great case to be made that metformin helps our appetite within a month or 2 by changing the gut biome. So that common side effect of flatulence, gas, diarrhea is probably a component of metformin changing that gut biome, and probably a sign that you're going to be making an impact on your appetite. Thanks for listening.